Good morning, everybody. Welcome back to another age-friendly live show. My name is Lenny Orlov. I will be your host today, and we have an exciting show. We will hear from Sustainable Housing for Ageless Generations and from Hopelink today. But as has become customary, I'm first going to ask you if this programming brings you value and you're watching this on YouTube. Go ahead and click the subscribe button and enable notifications so you won't miss any other programming that we have to offer. The other thing that I'd like to start with today is acknowledging the land that we're on today here in my apartment and at the city of Seattle. At the Seattle Human Services, we acknowledge that we are on the traditional land of the first people of Seattle, the Duwamish people, past and present. We honor with gratitude the land itself and the Duwamish tribe. To learn more, please visit duwamishtribe.org to learn about the Duwamish people of the inside, people who are still here, and you can find out information about how to get involved with the tribe. We hope that you will take a look, and we thank you for joining us in this acknowledgement. So, moving right along in our presentation, today we are going to start celebrating the National Fair Housing Month. Today is April 1st, April Fool's Day, but this is a month where we will have programming related to housing, and in a little bit we'll see what we have coming up in a couple of weeks on our other program, but today we'll hear from Jay Woolford, who is with Sustainable Housing for Ageless Generation, otherwise known as SHAG, and from Sara Sisco, who represents Hopelink Mobility Management. I believe these two organizations work very closely together, and we'll probably hear more about that later on. I want to note that Sara is making a return appearance on Close to Home. We'll link it up right here for you all to check it out when you're watching this recording. We'll also hear a brief update from our partner, the Seattle Public Library. What is age-friendly? And without going into it today, I will just refer you to our YouTube channel, which is called Aging King County. The latest video we posted, and it's just 2 minutes, and it gets into sort of the whole idea about livable communities and sort of the action plan and how Seattle approaches this worldwide movement to help people live in places that are better for growing up and growing old. And since you're here, you are an age-friendly champion. Whether you click the subscribe button or not, you're here. We appreciate you very much. And if you're here online, we do want to remind you that language access is available in the way of automatic captions, which are included in the following languages: Arabic, Chinese, English, which is the language of this presentation, so as an ADA requirement, it's there, Korean, Russian, and Spanish. And I think I'm missing Vietnamese. I'm trying to read on the slide in the original languages. And how is that going to work today? Well, we have a couple of moderators joining us in the virtual studio here. They are Michael Taylor-Judd, who will be behind the scenes today and posting all the great links that you see, and sometimes phone numbers and other resources in the live Q&A, which is the mechanism, sort of the vehicle for us to communicate back and forth. And we do appreciate you putting in your questions early, even while the presenter is still doing their presentation. We also have Justin England and Gira Hammam in the studio, who you will see later on reading those questions that you sent through for our presenters. Now, if you have a question, whether you're on phone or online, that goes beyond what's being presented here today, even beyond human services department that we represent and the Seattle Public Library, you are invited to call Community Living Connections. Community Living Connections is a network of organizations throughout Seattle and King County that can offer support with services and resources such as food and meals and a variety of other things. And you can reach them by calling 1-844-348-5464. I think I'm hearing my 4-year-old here, so I do apologize if that's coming through for you on my microphone. They have a website, and that website is communitylivingconnections.org. It's all one word, capitalization, unimportant, communitylivingconnections.org, and the number again is 1-844-348-5464. If you visit the website, you'll see that there are organizations throughout, as I mentioned, King County, and if you see an organization in your area, you're welcome to give them a call directly as well. If they don't offer a particular service, they'll refer you to another organization in this network. I mentioned at the outset that this being the Fair Housing Month, we do have another program coming up for you. It's a sister program of Close to Home. It's called the Civic Coffee Hour. And unlike Close to Home, which is on the first Thursday of every month, the Civic Coffee Hour is on the third Thursday of every month, with some exceptions. For example, in December, there isn't a coffee hour. This time around, we are going to welcome Emily Alvarado. She's a director of Seattle Office of Housing, and she'll cover a variety of resources for low-income homeowners and renters, with a specific emphasis on the impacts of COVID-19. In general, coffee hours are a way for community elders to connect with government decision makers like Emily, like Mayor Durkin, who was on the show a couple of months ago back in 2020, and like other department directors and county and even state leaders that we've brought on earlier. We certainly encourage you to check out those previous recordings on our YouTube channel, which was linked earlier in the program. And the way to join is still the same. It's the short link, which is on your screen, but for those of you on the phone, it's bit.ly/HFriendlyLive. Again, bit.ly/HFriendlyLive. Here, capitalization is important. It's H capital, friendly capital, live capital. And the number is still the same, 686-8357, with the conference ID 224-689-164. If that ever changes, we will certainly notify you separately. Both programs, the Close to Home that you're on today and the Civic Coffee Hour, and the coffee hour has been around for over a decade, but more recently, the Seattle Public Library has joined us in helping us bring these events to the community, first with just the coffee hour and now also with Close to Home. When and if we return to in-person programming where we have coffee, donuts, and other more healthy options to offer you when you visit with us, they will be at the Seattle Public Library Central Branch. There will likely only be the coffee hours, not the Close to Homes. Those will continue to be virtual, but we really do value the partnership that the Seattle Public Library offers. And every time, in person or virtually, we have a presentation, we invite the library to say a few words about what's happening at the libraries, even as the branches are at sort of a modified version of being open. And you know, why am I talking about it? We have somebody here who can actually speak to it with a lot more authority. Her name is Nancy.Slote, the special agent in charge of age friendliness, as I like to call her. She is the Older Adults Program Manager, known by her day title. And I will go ahead and switch it over to Nancy. And Nancy, please remember to unmute your microphone before speaking. You're now live on the Close to Home.
Thank you so much, Lenny, and good morning, everybody. And I'm also very happy that the library and Age Friendly can work together to bring you these programs, because it's so important to sort of raise awareness and the voices of all of the community organizations and individual people in the community who are working and supporting older adults. And of course, I count myself as part of this group of people as well. Thank you, Lenny, for giving me a few minutes this morning to talk about the library. So we have heard from so many patrons that people want the libraries open and they miss being inside the libraries. And I can tell you that the library staff also really, really misses interacting in person with all of our community and our patrons. We are working very hard to open some of the branches for in-person services, but we're now just waiting just a little bit longer so that library staff can get vaccinated, and that's happening right now. They're eligible to get vaccinated. So we should have at least a few branches open for some limited in-person services by the end of the month, sometime this month. Lenny, next slide. Meanwhile, however, we do have what we call curbside pickup. I hope many of you have found that already. You can place a hold on a book or any of our materials. You'll get an email or a telephone call saying that the holds are ready for pickup at your curbside branch, and then you just go and on the dates that branch is open, you go pick up your items. If you do drive and you have any difficulty sort of standing online, you can always call the branch, and the branch staff will check out your items and bring them to your vehicle. Another service that we have is free printing, and thanks to our Library Foundation, you can print up to 10 free copies a day. That'll be really helpful, especially for tax forms, which I'm going to talk about in just a little bit. Could I have the next slide? So besides all of our books and other wonderful collections, we're also here to answer questions. And you can do that by phone, or you could do that by email or chat if you prefer to do that. Our phone line is called Quick Info, and there's a phone number that I'm going to read, 206-386-4636. And there's amazing staff who answer thousands of questions a day. And in fact, you don't even have to remember that phone number exactly. You can just do the letters Quick Info on your phone, and that is the 386-4636 phone number. So that's an easy way to remember it. I think the people who are on the phone lines are geniuses. They can answer almost anything, and they work a lot helping people get our digital and our electronic resources like ebooks and like streaming movies, helping them get set up with their accounts, answering questions about how the steps that you take to get all of those digital items. So I really encourage you to use Quick Info or email or chat. Could I have the next slide? Our library website, which should be coming up in a minute, I just wanted to let people know that when we launched our new website several years ago, we also have many parts of it translated into 7 different languages. And again, you can call Quick Info to find out how you click into a different language. But I love that we're trying to make this more accessible to more people. Could I have the next slide? Everything actually is free at the library. When you want to check out a book, you just need a library card. And if you don't have a library card, you can go online and apply for one. Or if you're not comfortable with that or unable to do that, you can actually go to a curbside branch and fill out an application and get a card that very day. So I encourage you to do that. But anytime you have a question, you don't even need a library card for that or for any of our programs. Next slide, please. So one of our most popular services is being able to check out and borrow a hotspot, which gives you access to the internet. It's a little box. If you've never seen one, you basically turn it on, and your phone or your computer or your tablet will connect up to that network, just sort of automatically. And I'm not actually very techy, and it was just easy for me, so I know it's easy for most people. You basically, to get a hotspot, you need to put a hold on it and wait for that notice that it's come in, and then go pick it up at your curbside branch, and you can have that hotspot for 3 weeks. That's how long it circulates for, just like books do. Could I have the next slide? So I mentioned tax forms before. Many of you in past years, pre-pandemic, have maybe come to library branches to work with United Way or AARP who prepare taxes for free. You had an appointment at the library, or first come, first serve. So because our branches aren't open, we don't have that this year, but both United Way and ARP offer different kinds of virtual appointments and tax drop-off. So you can either call those organizations or go online and to those organizations and find out about tax help. Or you can call the library, call that quick information number, and they can walk you through what options you have and give you information about that. All of the curbside libraries do have some tax forms, like the basic 1040 and the 1040 SR, both in English and in Spanish. We can also print other forms for you at the same time if you need different schedules. Could I have the next slide? And I just wanted to tell you about another great program we have. It's the museum passes. We've brought it back. We've had it in the past. And there are passes available every day for certain museums. And the list is on the screen. It's the Birch Museum, MoCOP, Nordic Heritage Museum, Seattle Aquarium, and now just recently the Wing Loop Museum. So the instructions are on our website on how you reserve a pass. And then because of the pandemic, the museums themselves require you to make an appointment, a reservation time to come in at a specific time. So I love this feature, and I have to say that the Seattle Aquarium is one of my favorite places in Seattle. Could I have the next slide? We have many, many programs, virtual programs now at the library, and I have been hosting a number of programs of particular interest to older adults. Starting next week, on the next 3 Mondays, we are going to have a program from an organization called People's Memorial Association, and it's called Ducks in a Row, and it's about end-of-life planning, about advanced healthcare directives, and estate planning, and even funeral options. It's a wonderful series and very, very informative. You do need to register for it, and in just a couple of slides, I'll show you where you can go on the library website. Can I have the next slide? And throughout the month of April, we are going to be having 4 classes a week with Silver Kite Community Art. All kinds of classes in painting and drawing, dance, improv theater. One of our favorite and most popular programs is Bollywood Dance. It's coming up soon. People have said they just feel great coming out after the end of that program. They just sort of shake everything off. It's really fun. And the senior social hour, we have several times during the month. It's a really nice, comfortable kind of conversation hour, which is facilitated. So again, you do need to register for these events. And then the next slide, I just want to mention a program. This is from one of our partners from Seattle Parks and Recreation. It's next Wednesday. It's called Civil Conversation in an Angry Age. The program presenter is Dr. David Smith. He's a professor of philosophy and religious studies, and he's going to be talking about how we can talk to one another in such a polarized and politicized age, and what tools we can use. So I invite you to look at the Seattle Parks Department Lifelong Recreation website to register. We're going to drop that link into or you see it here on the screen, and we'll put it into the chat. And you can also phone them. We'll put that phone number into the chat for registration at 206-684-5177. And then finally, the last slide. I just wanted to invite you to come to the library's website. The pages for services for older adults is called Next Chapter. It's www.spl.org/nextchapter, all one word. And you'll find our calendar of programs where you can register. You'll find book lists, and you'll find a wonderful list of resources. So I invite you to visit there. And that's about it. I have one more slide, which just gives my contact information. And I'm happy to answer questions here in this program later on. Or I invite you to email me at the email address on the screen, which is Nancy.Slote @spl.org. So thank you very much, Lenny, for giving me some minutes here to talk about the library, because I love the library.
Thank you very much, Nancy. We appreciate you being here every time, and we look forward to hopefully soon being able to walk into the library like we used to, and kind of go through the books or the DVDs or wherever it is on the shelves. That's an experience that I think a lot of us are missing at the moment. So when can that happen? You heard the sort of the library's perspective. I do want to spend just a couple of minutes here covering some resources where you can learn more about where we are with the pandemic. As you may have heard on the news, there is a surge of cases here in King County and in Seattle. So despite vaccinations being available to more people, and we'll talk in a moment, what the eligibility is now starting yesterday, folks are still asked to practice social distancing and wear facial coverings. This information, as it changes, is available at coronavirus.wa.gov. And it's available in over 30 languages. So we do encourage you to check it out. There's a phone number you can use to ask these questions as well, which we'll talk about in just a second. One other thing that you can do on the site is you can find a vaccine location. You'll notice that there was another button there before called Vaccine Face Finder, and that's gone now because that is no longer being used starting yesterday. If you are eligible, you should either use this website to find a vaccination site or call their hotline to go ahead and get an appointment. So the eligibility now includes people over 60 years old, people 16 and older with 2 or more underlying health conditions, and people who are in congregate settings such as high-risk critical workers, staff volunteers, and residents. Again, more detailed information is available at coronavirus.wa.gov. So what phone numbers do they have available? They have an information hotline, as I mentioned, that's available at 1-800-525-0127. On Monday, they're open 6 a.m. to 10 p.m. And then Tuesday through Sunday, it's 6 a.m. to 6 p.m. And that is also true on observed state holidays. If that number is busy, you can call 1-888-856-5816. That is the same number, it's just available as a backup. Now, a different number I wanted to call your attention to is Washington Listens. That's a hotline for anyone who is experiencing stress related to COVID-19 to call and talk to someone. That number is 1-833-681-0211. It's open Monday through Friday, 9 a.m. to 9 p.m. and then on weekends, 9 a.m. to 6 p.m. Again, 833-681-0211 is the Washington Listens line. We hope that you'll take advantage of both of these resources, and let your friends know about their availability. SHAG, Sustainable Housing for Ageless Generations. I'm going to turn it over to Jay in a moment, but first, let me say a few things about Jay. He has over 30 years of executive management experience in senior housing, working with affordable senior housing, continuing care retirement communities, assisted living and independent living, and other senior housing options. I'm sure you'll hear about this from Jay, but you can find SHAG at Housing for Seniors. That's with the numeral 4.com, housingforseniors.com. So again, we hope that you will go ahead and put in your questions in the live Q&A, where you've seen different links to things like our YouTube channel, like Community Living Connections, and the library websites. We hope that you will go ahead and let us know what you're wondering about in terms of the work that SHAG does, and later on Hopelink. And then we'll stop for questions between these two presentations. So without further ado, I'm bringing the spotlight on to Jay Woolford's camera. Jay, please remember to unmute your microphone and you will be live on Close to Home.
Great, just did. Thank you, Lenny, and thank you for the opportunity to be here today. I want to start off by at least a shout out to Nancy and what the library is doing. I think it's an amazing array of programs that are being offered. It's just incredible. I also want to thank you, Lenny, for having us on the show. We've been a big supporter of age-friendly Seattle and age-friendly cities from the very beginning, actually, when the city was really considering the option of becoming part of the worldwide age-friendly program. And we also are, we really use the tenets of age-friendly cities and the AARP's dimensions of livability as we think about our communities in the context of the neighborhoods that they're in. SHAG, or Sustainable Housing for Ageless Generations, is a nonprofit organization that has been around for well over 35 years now. It was started back in 1988. We provide affordable senior housing, and it's done through partnerships with other organizations or partnerships with developers in order to help create the housing, predominantly utilizing the low-income housing tax credit program. And actually, next slide, Lenny. We serve well over 6,000 residents in the Puget Sound area. And just recently, as of the last month or so, we have affiliated with another nonprofit affordable housing provider based over in Bellevue, and have been able to now add an additional dozen or so communities and bring in our total to about 7,000 residents throughout the region. So our focus has really always been on providing affordable senior housing. As I just said, we've actually expanded into family housing too. But we also spend an awful lot of our time really advocating for housing sustainability and for quality of life for seniors. And that's done through advocacy work that we do at the state and the national level, as well as the commitment to really expanding support and services in our communities. And in order to do that, next slide, several years ago, we created a sister organization called the Community Life Foundation. And through the Community Life Foundation, we have really kind of focused on ways that we can provide support and services to residents in our communities. SHAG is not a direct service provider, but what we do is we look for ways to be able to coordinate and connect people with programs, supports, and services that will help them sustain their housing and sustain their independence. And that, one of the reasons why that is so critical to us is because of the fact that one of the things that we observed early on is that, in particular with affordable senior housing, it's not just about putting a roof over somebody's head. It's really about how we can continue to support people to be able to maintain both their housing and their independence. And a lot of that comes about because, or I should say, the ability to maintain and sustain housing is just so essential. I mean, the way that housing works in the area in particular, when it's in affordable or in many cases tax credit, housing prices, the rent rises with the changes on an annual basis of the area median income. And we're in an area where we've seen over the last several years, and we'll probably continue to see, significant growth in income in our area. The problem is folks that are living on fixed incomes are only seeing income increases at the pace of really what the CPI is. And so where we may be seeing increases in median income in the area in excess of 5, 6, 7% per year, on average, we see increases in Social Security at barely 1%. And so by default, we begin to see gaps that are growing. And one of the things that the Community Life Foundation does is to help find ways to sort of manage and fill those gaps. COVID has been especially hard on seniors. Next slide. And so part of what we've been doing over the last year is really finding ways that we can help support people that are going through financial stress, food insecurity, finding ways of accessing health resources, transportation and other services. And again, it's great to have Sara on this program because we have a wonderful partnership with Hopelink and the ability to, again, augment the transportation services that we provide to be able to get people out to manage their essential needs. We've also been looking at ways for accessing technology, both in terms of to manage sort of the social isolation that people are struggling with, as well as using technology to be able to connect people both with health resources and other types of resources. So COVID has really dramatically changed the way that we have been able to manage our communities over the last year. Next slide, please. And it really, made us go back and kind of look at how we were handling things and begin to think of ways that we would have to not only do it during the challenging times, but also what effects is that going to have for us as we sort of move out of the pandemic phase and back into whatever the new normalcy may be. But our focus has been on keeping the residents in the community and staff healthy and engaged. Unlike many of the senior facilities that may be, skilled nursing or assisted living that really went into sort of a mandatory lockdown. We have remained, sort of open, but under particular regulations that we have, tried to manage in order to ensure our residents and our staff are continue to be safe. And I would tell you that we were very lucky, as well as through the resilience of residents in our communities and our staff, in terms of, again, when we're serving, close to 7,000 folks, that our incidence of COVID in our communities was very, very low. It was less than 1%. We also found that we needed to, rise to the response of, but not only essential services, but things like nutrition, and then also finding ways to get activities in our communities. And so I think we had a couple of success stories that I really want to kind of highlight. Next slide. Early in the in the pandemic, we recognized that food insecurity was a major issue. And so we had already started to create community food pantries in our buildings, and a lot of them were stocked by donations from residents, from staff. And then during the pandemic, not only were we able to get significant funding from organizations like the Albertsons Foundation, Safeway Foundation, and through donations from our partners in the ownership of the buildings, so that we raised probably close to $500,000 just in order to be able to support nutrition needs in the communities. And we went from really, pre-COVID, where we were doing, food boxes and meals on average of about 600, to, during the pandemic. I mean, I don't even know what the numerical factoring is, but, where we've provided over 34,000 meals and food boxes, to residents in our community. And I think that need, is really evidencing, I believe, an ongoing concern in terms of the ability to continue to get nutrition to our communities. Another area that we focused on was technology. I mean, all of our communities offer internet, they offer cable, but really it's a matter of being able to get, expanding the technology and the access to the technology to be able to set up more telehealth opportunities. And in that regard, next slide. We've augmented our communities by actually having a healthcare advocate in our communities to be able to work with residents in order to make sure they're accessing healthcare. But then we've also been fortunate to get funding to help us purchase tablets and additional Wi-Fi hotspots and access points for residents that have in the past been using computer centers that we have in our buildings, but because of COVID, most of those had to have been closed during the pandemic. And so again, we were looking for ways to be able to provide a continuation of that kind of support for residents. And then the one I want to highlight is just vaccinations itself. Next slide. And through the work of quite frankly, the State Department of Health, the King County Public Health, and working with local fire departments and the National Guard, we have been able to run COVID clinics in all of our communities. And we have completed the first doses of vaccinations in all of those communities. And as of last week, started on the second doses. Actually, when we wrote this, I think we were at 43%, but today we're actually at up over 50-some% in terms of folks being able to have gotten their vaccination, though we have made it available to all residents in order to be able to do that. And it's been a heavy lift from a coordination and staffing standpoint to be able to do that. But again, through the partnerships with, in particular, the fire departments, it's just been amazing the way that they've been effective in terms of being able to move forward and getting this done. So as we think about, SHAG as it's moving, post-COVID, hopefully, and we are starting with protocols now in terms of moving into the third phase and starting to be able to open up community spaces on a limited basis and starting to move activities back into our communities. Next slide, please. We're excited about what the future is going to bring. We have created a number of partnerships during this period that we know will continue in terms of being able to reach residents and continue to grow the activities that we're able to provide in our communities. We have been during this time also been fortunate in that we've been able to continue to grow our staff. And so we have been increasing our number of resident service coordinators, as well as folks that are in what we call our partnership group, who really focus on making those connections with things like the library systems or nursing schools or Silver Kite or other types of programs that we can bring to our communities and really help to again grow and augment the supports that are happening there. So that's where we've been and that's where we're going, and appreciate the opportunity to talk a little bit about SHAG.
And we appreciate you being here, Jay. And hopefully one of the partnerships that you were referring to here might be with Age Friendly Seattle and the Public Library on some of these events as the phases change and people start to gather together. We're hopeful that we can maybe work out a way of broadcasting these opportunities to folks in your living communities, where either it's an in-person event or a fully virtual event, but it's brought, we're not relying on people having internet connections or or cell phones and things like that. So I definitely want to continue that conversation, and thank you for being here today.
Yeah, that's wonderful, and we look forward to that opportunity. Thank you.
Yeah, awesome. Well, let's see. We are going to go to questions now, and let me turn it over to Justin to see if any questions have come through online.
Hi, thanks, Lenny. So there's been one question that's coming in. I'd love it if anybody else has any questions, please get those put into our live Q&A. But the one question that's here, it's from someone who provides social services in a SHAG senior building. Could you share information about where or how you got funding for laptops and tech assistance?
That's a great question. And actually, that was the work of one of our service coordinators, and I believe the initial funding came from actually in Whatcom County. And I honestly don't know exactly where the funding was coming from, but I think my contact information is available, and certainly would be happy to follow up, to provide more information on that.
All right, so was that the only question there, Justin, for the moment?
Yeah, that's the only question that we had in the chat. I will let you know if anything else comes in.
Very good. Okay, so with that, why don't we go ahead and transition to our next presentation, which I believe will also have a live demo there. So next up, we do have our friends from Hopelink, and I'm going to do a brief introduction of Sara, who, as I mentioned, is making a return appearance today. Sara is the program manager for education and outreach programs on the Hopelink mobility management team. She manages with the mindset that transportation should be a resource and not a barrier for all in the community. Her programs provide sustainable, consistent opportunities for partners and stakeholders to bring personalized transportation education and resources to their communities. Sara joined the Great Pacific Northwest nonprofit community when she earned her Master's of Nonprofit Leadership at Seattle University. When she isn't working on education and outreach, she can be seen or can be found walking the Sammamish River Trail with her dogs Dexter and Dobbins. Welcome back, Sara. Very good to have you back on the program. You're now live.
Thanks, Lenny. Glad to be back. And I'm glad that to be able to share that our Find a Ride website that I was here in the fall talking about is live and provides a lot of COVID resources. But the main thing that I want to talk about today is our coordinated vaccine transportation helpline. And this is really a program that's designed to help you get to and from your vaccine appointment without running into a ton of barriers. So you can go to the next slide for me, Lenny. So it's a one-stop shop for finding transportation to and from your vaccine appointments in King County. Individuals, caregivers, caseworkers, medical professionals, vaccine schedulers, anybody can give us a call to receive individualized transportation support for themselves or the rider they're working with. For example, my colleague just received a phone call for a group of 25 individuals who need to get their vaccine but don't have a way to access transportation. And so we're going to coordinate with our partners to really help solve that problem. We're skilled problem solvers who understand the ins and the outs of our complicated transportation system, and we really don't want you or your loved ones to feel like they can't get a vaccine because getting there is too complicated. Transportation, I will always say, is extremely complicated in King County, and so we really want to make sure we can reduce that barrier. Our line has been available for almost a month now, and I can say that we've had 100% success in finding every single person that's called us a ride, including that group of 25 that I mentioned. It is staffed by my team who are bilingual, bicultural, English, Spanish, but we also have access to a language line interpreters. You can go to the next slide. So it's open Monday through Friday, 8:30 to 4 p.m. I've listed the phone number there, 425-943-6706. And if you need to speak another language, please press 5 and state your language. I've also included the intake form where you can fill out the online form and we'll give you a call back when it's convenient to you. You can go to the next slide. So as I mentioned, this service is being operated by my team in partnership with the Regional Alliance for Resilient and Equitable Transportation and the King County COVID Vaccine Mobility Task Force. And the reason I mention this and I list out all of these partners is to let you know that we're working with public health, we're working with the transit agencies, we're working with aging and disability services, sound generations, Catholic community services, the list goes on. And so when you call us, you really are in good hands, and we have a comprehensive network that's really going to help us help you. You can go to the next slide. I forget which order my slides are in, so that's why I'm waiting for the next slide. So the eligibility for this is targeted at the BIPOC community, seniors, immigrants, refugees, individuals with disability, and those with limited English proficiency. However, we can provide transportation resources to any person that calls. We know that the vaccine eligibility is opening up on what feels like a weekly basis, and so please give us a call. We're happy to help trip plan and find out solutions for you. This service is really intended for individuals who have their appointment, not to schedule your appointment. We cannot schedule your vaccine appointment for you. We can simply help you to get there. So as soon as, if you know, I have my appointment in 4 days and I don't know how to get there, today is the day for you to give us a call and find out how we can assist you. The sooner you know, the better service we can provide you. Let me go to the next slide. And I just wanted to go through a little bit about how it works so you can see the kind of progression. You call in, we intake your information, and likely we will ask to call you back because we want to take a few moments, sometimes up of an hour or two, to talk to our partners and figure out what's the best service for you or the person you're calling for. We reach out to our transportation provider network, we secure a ride, we let the client know, the ride occurs, and then we likely follow up to make sure that you got there successfully. And so it's really about providing you customer service that allows you to know that you're in good hands through this entire process. Whether we end up securing you a high shuttle ride, we help you trip plan on Metro, or maybe there's no good options and we use something like Uber or Lyft, we will provide that ride at low or zero cost to you, the user. So it's really about getting you there, making sure that time isn't a barrier, cost isn't a barrier, that you feel comfortable. We have a lot of services at our disposal. So I really encourage you, if you're struggling or you're working with somebody who's struggling, please just give us a call and we're happy to help. You can go to the next slide. Like I said, we're doing everything we can and we've had a 100% success rate in fulfilling rides. But if you call us with 10 minutes to go before your appointment, we're unlikely to be able to fulfill that ride for you. We request that you call us at least 3 to 5 days in advance to allow us to give you the best information possible. But for same day rides, please call a minimum of 90 minutes in advance. Otherwise, we're really unable to help you. Like I said, there's no cost associated with this program, and we're doing everything in our power to ensure that all of these rides can be free. There may be a minimal cost associated with public transit, but we're looking for the lowest cost option for you. And then we're helping cover rides as well. So I can't 110% guarantee a ride every time, but I can say the more notice you give us, the easier it is for us to provide that ride. And we've had a 100% success rate as of today. You can go to the next slide for me. All right, Lenny, I'm ready to click on my website. I always don't want to throw everybody off, but we're going to transition out of the PowerPoint and into a website. Perfect. Thanks, Lenny. I appreciate it. So if you want to just browse your options and see what might work for you, or you have a ride in a different county, we've put together our findaride.org/COVID website. And this has all sorts of resources. This is the really great website that I debuted way back in the fall on this program and is live. It is ready to go. And we've added this COVID-19 transportation resource page. As a reminder, please schedule your appointment before you look for transportation. But it breaks down all of your options by the Tri-County region. So you'll first see Snohomish, and then if you can just scroll down a little bit, you'll see King County. A little further. There we go. There's King County, and it's giving you, are you a senior? Do you have a disability? Do you have Medicaid? What are kind of your qualifiers that will best help us serve you? And if you really are struggling to understand this website, or you don't see a service that might work for you, I've included our phone line, our coordinated vaccine transportation helpline up at the top. And like Lenny's doing, you can drop down and see what the different options are for you. You can also see Pierce County resources. And then if you scroll a little bit further down below these drop downs, below that public transit section, a little bit further, we also just have other information about COVID-19, including transportation providers if you're COVID positive, how to schedule a vaccine appointment, and just a wide variety of services that might be available to you. But it's a really nice way to just kind of see what might work for you. And if you're still struggling to find options, then please give us a call and we'll be happy to assist. I won't go through the rest of the website, but it is updated. It is live. Feel free to use it and let us know if there are any, if you have any feedback. Our contact information is all over the website. It does work with screen readers, which is wonderful. So you should be able to access all of that if you're using a screen reader. Unfortunately, the site is still just in English, but if you have questions, please give us a call and we'll get an interpreter on the line to assist you. So that is what I wanted to share. I know we're just a couple of minutes over, but I'm happy to answer any questions as well.
All right. Thank you very much, Sara. We appreciate you coming back and actually showing us what the site looks like now that it's operational. We're gonna switch back to the PowerPoint in a moment, but first I'd like to switch the camera over to Gita to see what folks are asking in the live Q&A. And while we do that, I would encourage those of you who are still here, I know we're a little bit over time, to type in your questions in that live chat so that we could answer them. And if you have to go, that's fine. Once this is uploaded on our YouTube channel, you're welcome to leave a comment in the comments section and we will alert Sara and Jay to provide a response. Okay, Gita, what do we have going on in the chat there?
Hello, well, thank you, Lenny. The question that came in for Jay earlier was, are there annual rent increase limits in SHAG facilities?
Yeah, thank you for the question. And yes, there are limits to annual increases in the communities. And again, that's regulated by the change in the average median income in the counties. And so the actual limits are posted every year through the Washington State Housing Finance Commission and HUD. So they set what the annual increases would be, or the income limits.
Yes, so that's all the questions that I see right now. So I'm going to hand it back to Lenny.
All right. Thank you very much, Gita. And so this is the contact slide for Sara Sisco over there at Hopelink Mobility, Education, and Outreach. Well, I want to thank all of my presenters today. I appreciate you being here virtually. Maybe someday we can do some kind of an event with people there. Maybe it's a hybrid event, as I had proposed to Jay earlier. Let's keep the conversation going on that. On May 6th, Close to Home is back, and May will be Older Americans Month, also known as Better Hearing Month. So our first event that month is going to be a special 90-minute panel on better hearing. We'll hear from Diana Thompson from our own Advisory Council for Aging and Disability Services in Seattle and King County. We'll hear from Sherry Perazzoli, who is the president of the Washington State Chapter of Hearing Loss Association of America. And we'll have an audiologist, Dr. Brad Ingro, who is a director of audiology at the Hearing, Speech, and Deaf Center. Last time, our captions didn't work because of a software issue with the Microsoft platform. And so folks who rely on captions couldn't participate. So again, with apologies about that, the captions were on today from what I understand, and we hope that they will continue to be available. And we'll hear a lot more about, about this topic that we need to hear more about. So that's all we got for you today. We hope that you did get some value out of this, out of this presentation and out of these, out of these events in general, whether they're with community members or if they are with government officials. this is what age-friendly is all about. It's about livability in all 8 senses that you can find, that Jay mentioned, in terms of transportation and housing and civil and social participation. This part is kind of social virtual. We again hope to be back in person with you again very soon. In the meantime, go ahead and give us a like and hit the subscribe button so that you can be an age-friendly champion along with us. Thank you again. Enjoy the rest of your day, and we'll see you in a couple of weeks.